Hi, it's Dr. Sweeney here tonight to talk about inflammatory bowel disease. Now, inflammatory bowel disease can be really nasty and it can take different forms. The more common types of inflammatory bowel disease are Crohn's disease, which is a condition that can affect anywhere from the mouth right down to the anus. It can cause patches of inflammation. When the bowel becomes inflamed, it stops working properly. It doesn't absorb things properly. You can often produce stools which are very loose, mucousy, sometimes bloody, ulceration in the mouth and the lips, all the way through the whole bowel. The other more common type of inflammatory bowel disease is ulcerative colitis. This just affects the colon. So colitis is inflammation of the colon, and again can cause malabsorption. That's when nutrients aren't absorbed properly into the body. Altered bowel habit, diarrhea, abdominal tummy pain, bleeding, mucus production by the rectum, and can generally lead to people losing weight and feeling increasingly tired, lethargic and unwell. Now, it's really important that if you do have an altered bowel habit and have any rectal bleeding, any mucus, any abdominal pain, and you do suspect that you might have inflammatory bowel disease, particularly if you have a family history of it, because it tends to run in families, that you should definitely go and get checked out by your healthcare provider. It can be identified with stool tests, testing for something called a fecal calprotectin. This is looking for inflammation within the bowel. An inflammatory marker, a blood test called a CRP, a C-reactive protein. This can be raised. Check for anemia as well. Anemia means a lack of blood, so a low blood count. That can happen if we're losing a bit of blood through the bowel. So that's all helpful. Blood and stool tests basically. Imaging of the bowel can be helpful as well. So often if you're referred on to a specialist, that can take the form of MRI or CT scanning. Endoscopies can be helpful. These are fine tube cameras which can go down into the stomach or up through the back passage and around the bowel. Samples can be taken to confirm or refute the diagnoses. And if you are diagnosed with inflammatory bowel disease, then there are really clever medications now. The original sort of treatments were steroids to try and calm the inflammation down, but they have these biologic agents now which can really modify your immune system and its response alongside these diseases to really control things much more effectively, trying to return you back to being more comfortable, your stools and your bowel habit being more normal, your weight normalizing as well. So it's really important that if you do think you could have inflammatory bowel disease along these lines, that you do go and get things checked out and get on the correct treatment as early as possible so that you're not suffering. I hope that's been helpful. Until next time, see you later.